I'd like to tell you the most common mistake that doctors and medical students make when it comes to one of our most common clinical tools and instruments, the stethoscope. Everyone who's a clinician, and a doctor in particular, has a stethoscope, and there are a lot of other clinicians and allied health that use stethoscopes, particularly speech pathologists and physiotherapists. It's such a helpful tool, and it's very normal to see doctors, whether in the clinic or on the wards, wearing the stethoscope around their neck, ready for use at any time, because it's such an easy tool to use. However, the most common mistake is this. You can see here, I have an adult diaphragm on this side. We use a diaphragm to measure high-pitched noises, usually because of high-pressure sounds, such as airway noises, and in particular, high-pressure flow of blood through the aortic valve and other areas. We also use it in combination with the sphygmomanometer to measure blood pressure, again because of the high pressure creating high-pitched sounds. On the back, however, when you take a stethoscope out of its box, whether you're a first-year medical student or you're a junior doctor who's decided to upgrade their gear, it'll come out of the box with this. And a lot of people say, that's the bell. But you're wrong, it's not the bell. This is a pediatric diaphragm because it's got the pediatric diaphragm over the bell. And this is great if you're a doctor that looks after adults and children, particularly general practitioners. Having a stethoscope with an adult diaphragm and a pediatric diaphragm is a really versatile tool. However, if you're like me and you work exclusively with adult patients and don't see pediatric patients, or if you're a medical student where the majority of the practice patients that you have in medical school and the majority of the placements that you do as a student are with adult patients, I would really encourage you to take off this pediatric diaphragm and hold on to it for the times that you do pediatric rotations. But otherwise, we need to switch over, and in most boxes with a stethoscope, you will find this. This is a bell ring. It goes over the bell so that it's not cold and it's comfortable for the patient and creates more of a seal. And when it does that, it allows you to hear low-pitched noises, usually from low-pressure areas, and in particular, useful for the mitral valve, and also useful for listening to carotid stenosis. Here you can see I've put the bell ring back on, and so now I have an adult diaphragm and an adult bell ready for use, and all I need to do is flip it around like that so it clicks, and I've re-engaged the other side. One of the areas that we use the bell and the diaphragm together is actually when listening to the neck and the carotid artery. However, there are two ways to listen to this. Some people would argue that because of the small area of exposure in the neck, we should use the bell. And it's true, and if you read Tally and O'Connor's textbook on clinical examination, they will recommend that the bell is the best tool for listening to the slightly lower pressure sound and therefore lower pitch of carotid stenosis. However, the most common reason for listening to the carotids is part of the cardiovascular examination, where we're listening for radiation of aortic stenosis. Because the aortic valve has one of the highest pressure points and smallest areas of any vessel in the body, it has a very high pitch, which is why we listen to the diaphragm when we're auscultating over the precordium. The same should be true when we're trying to listen for radiation of aortic stenosis. It's still a high pitch, high pressure murmur. Therefore, the diaphragm is the best tool to use in order to have the best chance of detecting that radiation. Therefore, I recommend to you that we use the diaphragm when listening to the neck, and if you wish, you can flip it back over and use the bell to listen for carotid stenosis. Thanks for listening.